Today we are going to discuss about face mask or reversible headgear. Face mask is an extra-oral traction appliance used to correct skeletal class 3 malocclusion. Ickham in 1972 was first to use a reverse headgear. Reverse headgear may be used to protract maxilla. The principle is of a pulling force on the maxillary structures with a reciprocal pushing force on the forehead or mandible through facial anchorage. Headgears which cause a forward pull on a maxilla are called reverse pull headgear, also known as protraction headgear. Sites of anchorage are anchorage from chin, anchorage from skull, anchorage from chin and forehead. Indications of reverse pull headgear are mild to moderate class 3 cases with retroussive maxilla. It can be used for selective rearrangements of palatal shells in cleft patients, corrections of post-surgical relapse after osteotomy is used along with maxillary expansion. Components of face mask are chin cup or chin pad, forehead support, elastics, metal framework, intraoral splint or devices. Chin cup used to take anchorage from chin area. Protraction force delivered to maxilla delivers a reciprocal force to the chin to push it backwards. Restrains forward growth of mandible by changing direction of growth from forward and downward to backward and downward. Forehead cap or support is used to take anchorage from forehead. Elastics is used to apply forward traction on the upper arch. Framework connects all parts of face mask. Gives attachment rods to which elastics are attached from intraoral device. Intraoral appliance, banded or bonded palatal expansion type of intraoral appliances with posterior biplane. They disarticulate and free the circummaxillary sutures that eases protraction of maxilla. Types of face mask: protraction headgear by Ickham, Delary face mask, Tubinger model, Petit type of face mask. Thank you.